Welcome to The Doctor Is In, brought to you by Bay Area Medical Center. Yes, the program is back, and we have as our guest today Dr. Michael Karkkainen, who is an alumnus of Michigan State University and who completed his internship and residency with Ingham Medical Center in Lansing, Michigan. Dr. Karkkainen is a board-certified surgeon at Bay Area Medical Center and is a member of Aurora Bay Area Medical Group, who has been practicing in the area for over 20 years. His practice is a broad spectrum of general surgery, utilizing the latest surgical techniques, including minimally invasive surgery and a patient-oriented, compassionate approach. Welcome back to the show, Dr. Karkkainen.
Thank you very much, Jim. Happy to be here.
All right, and today we're going to talk about varicose veins. So first of all, let's define what a varicose vein is.
Well, varicose veins are pretty familiar to everyone. Basically, they are enlarged or distended veins with blood. Sometimes they can have clots in them. And they are very, very common in the United States. About 48 million people will suffer from varicose veins in their lifetime. The biggest thing with varicose veins is, when do you have to do something about them, or when can you just treat them conservatively, or do you have to treat them at all?
All right. What causes them?
The most common cause for varicose veins is family history. Usually you'll have a history in the patient of their mother or grandmother or relatives having varicose veins, and oftentimes had them later in life or didn't necessarily do anything about them. So that's the most common thing we see in terms of family history. The other thing is sometimes people with jobs that have prolonged standing or have a lot of pressure when they stand or have to lift heavy things can develop varicose veins. And what basically happens is there's three systems of veins in the leg. There's the deep system, which carries about 90% of the blood back to the heart from the lower extremities. There's the superficial system, which carries about 10%. And then there's a connecting system called the perforating veins. The deep system is the one where you may hear people get a blood clot that can travel to their lungs, or they have it after surgery, or they have it after traveling long distances and not moving around on airplanes or buses or automobiles. And those clots and those vein problems are serious and need to be dealt with, usually with clot-dissolving medicine or anticoagulation, blood thinners, to keep those clots from getting more extensive or from traveling. The veins we're talking about with varicose veins are the superficial system, which are the veins just underneath the skin. The most common running from the groin on the inner aspect of the leg all the way down to the ankle. And that's the veins that we refer to when we talk about varicose veins. The perforating veins are veins that connect the two systems together, and they're not treated very commonly. They're sometimes a cause of varicose veins, but rarely. The typical problem is the main vein up at the groin, called the greater saphenous vein, becomes incompetent. Veins have valves that are supposed to allow the blood to go in one direction. So the muscles of the leg, as you're walking or exercising, squeeze the blood up through the vein, and to keep it from running in the wrong direction, there's little valves, which are one-way valves. As these valves fail, the blood then pools down in the legs and the veins get stretched or distended or enlarged, and that's where you see all the bumps and lumps and whatnot for varicose veins. The biggest problem with varicose veins is that they can cause pain, they can cause itching, they can cause a heaviness of the legs. They also can cause ulcerations of the legs, which is probably the most severe problem with varicose veins.
All right, so there's more symptoms than just the appearance.
Absolutely. I mean, cosmetics are important, and certainly cosmetics is taken into account. But in terms of the qualifying indications for treatment, in terms of insurance approval, it's usually some type of symptoms, whether it's aching, heavy legs, or ankle swelling or leg swelling. Sometimes the skin will turn brown or yellow from the blood pooling in the area, redness of the skin. Some people also develop, like I said, ulcerations of the skin, or what's called irregular patches of skin or atrophy of the skin. And these things are signs that it's long-standing disease and it should be treated.
Now, you mentioned that heavy lifting and things like that can make things worse. Are there things that raise your risk for developing the varicose veins?
Absolutely. Varicose veins are much more common in women. than they are in men. They are related to pregnancies, obesities, menopause, aging, prolonged standing, any injuries to the legs, abdominal straining where people have to lift heavy objects or strain. They are not caused by crossing your legs or your ankles. So sometimes people think that's what was the etiology or the reason they got the varicose veins. That is not the cause. So there's other things that can have an effect, as well as some things in the pelvic venous system, but that's much, much more uncommon than the usual factors we've talked about.
All right. Now, you mentioned that it is more common in women, and is it is also something that we get more of as we get older?
Absolutely. As we age, as you know, everything starts to change in our body and things start to wear out. And these valves in the veins certainly are much more common to be incompetent or to leak and allow blood to go the wrong way as we get older. So it's a very common problem in people as they get into their 50s and 60s as opposed to the under 20-year-old group.
All right. This is The Doctor Is In, and the doctor today is Dr. Michael Karkkainen with Bay Area Medical Center, and we're talking about varicose veins. First of all, mention the difference between spider veins and varicose veins.
Spider veins are actually small veins that are underneath the skin, very close to the surface, so they will appear as a blue kind of vein. Sometimes people call them spider veins around the ankle. Other times they're called reticular veins. And these veins are mostly cosmetic in terms of their symptoms, in terms of their approach to treatment. They are not generally covered by insurance to treat spider veins because it is a cosmetic issue and does not really have any medical indications for problems. They can be treated with injection sclerotherapy, where caustic type chemical is injected into the vein and causes it to kind of shrivel up and resolve. But once again, that's usually more of a cosmetic procedure, and insurance usually doesn't cover that type of treatment.
The varicose veins, how long does it take for them to develop to the point where you start to think about doing something?
Well, that's a good question. I think that if you do some preventative things, you probably can stop some of the progression of varicose veins. The veins that give us the most trouble in terms of symptoms and ulcerations and major issues are the ones from the knee to the ankle. And so compression socks that are prescribed by a healthcare provider with graduated compression will help stop the progression of the veins. It will not make them go away per se, but it will make them not get worse as quickly. Elevating the legs obviously is helping as well, and other things like resolving obesity and adjusting what you do in terms of physical activity. Exercise is good. Powerlifting or anything that's straining is worse for those type of issues. We think that as people use the compression socks, they seem to resolve some of the progression. However, the socks are sometimes difficult in the summer weather with the heat and itching, and people get rashes, and sometimes they're very uncomfortable. And also, of course, they are sometimes not as cosmetically appealing as possible to have compression socks on with your shorts in the summer.
Probably. So if you don't do anything about your varicose veins, what's the consequences?
Well, the worst consequence is progression, where you get massive varicosity, so you can have legs that look like, they have all kinds of ropey veins, and they can get clots in them, and that can give you pain, as well as skin conditions where you get the dryness, redness, or ulceration of the skin, where the vein actually starts to break through the skin, and that can be a difficult problem to heal. I think that anyone that has symptoms or signs that they have venous disease probably needs to get evaluated and have a workup, which usually consists of a physical exam as well as a reflex ultrasound study where we look at how the blood is flowing in that leg, not necessarily how the blood is getting to the legs, but how the blood is returning from the legs, to see if there is incompetence of the valves of the veins. If that's the case, then you're a candidate for some of the newer surgical procedures that we use today to treat this problem.
So you go see your primary physician first, and they'll point you in the right direction?
Correct. Most of our referrals for varicose veins either come self-referred or from primary care physicians who feel like the patient's disease has progressed or there's evidence of significant venous disease, and that then would in turn require a referral and a consultation and then the appropriate imaging prior to any type of surgical intervention.
Okay, so eventually it gets to you, and then what are the options? What can you do for the patient?
Well, once we see the patient and evaluate that, yes, this is indeed venous disease and not arterial disease, so we usually do the ultrasound workup, and then pending those results, we'll see if they're a candidate for one of our minimally invasive procedures. The most common one we do today is called a venous closure. It's capital V-N-U-S. And what we do is we basically access the vein through a small incision just below the knee, pass a probe up to the groin, and then seal the vein in place with microwave type energy or radio frequency. Laser can also be used, but the results are no better with the laser than they are with the radio frequency closure, so that we commonly use the radio frequency because it's less expensive and there's less complications. The traditional approach to dealing with varicose veins was to do what was called a vein stripping, and that's where the vein was just physically removed from the groin down to the ankle. And that was somewhat traumatic, and people usually had a lot of bruising and had pain and were usually off work 2 to 3 weeks. And also there was a concern when heart bypass became prevalent that those were the veins that were used for bypass, for heart bypass conduit. And there was concern that if people lose those veins, that if they ever needed bypass, they wouldn't be able to do that. However, we know now that varicose veins are of no value in bypass surgery because they can't be used. They're too thin and dilated. And also that most of the bypass today is done with arteries either in the chest or in the arm that are basically harvested for bypass procedures. In this day and age, the most common procedure is the venous closure procedure, either with laser or radio frequency, where the vein is kept in place and treated right where it anatomically is located by sealing or closing the vein so the blood can't go the wrong way again. And that in part then causes the veins below that to dry up and not become enlarged, or if they are enlarged, they will start to shrink and go away.
So they just kind of go away?
Yes, the veins are basically, once they become sealed and the blood can't get back down that direction, the vein starts to basically seal itself off and become somewhat of a fibrous tissue, and it just doesn't cause any more symptoms. The other thing we know is that with this procedure, it's an outpatient procedure, and the patient usually can be back to work within 24 to 48 hours with minimal, if any, discomfort. So it allows them to basically have an outpatient procedure and be right back at full activities.
Is there any downside to not having those close to the skin veins?
Really not, because as we mentioned, 90% of the blood goes through the deeper system, so it really is kind of an accessory system. So there's really no detriment to the patient. As we mentioned earlier, the idea behind bypass surgery, grafting, and whatnot has been kind of answered with the fact that these veins were not real useful once they became varicose veins.
So how many veins do you plug up at a session?
The main vein we plug up, or actually seal, is called the greater saphenous vein. So that's the vein that runs from your groin to your ankle on the inner aspect of your leg. Once that's sealed, then a lot of the secondary veins will go away because the blood is not going in the wrong direction any longer. So we typically will wait 2 to 3 months after the procedure to see if there's any residual veins that have to be dealt with. And if we have to deal with those, then we basically remove those through a small little stab wound at the vein itself, and that's called a microphlebectomy, where we basically remove any residual veins that may be enlarged yet.
How long has this minimally invasive system been available?
I would say it's about 15 years now. It kind of came into vogue about 10 years ago, where everyone started realizing that this was a better way to approach the veins. Unfortunately, the initial probes that we used to seal the vein were very slow and weren't very precise. So now we have very good catheters, and there's a closure fast system is what it's called, that allows us to do this procedure in about 15 to 20 minutes per leg.
Okay, so it doesn't take long at all.
No, exactly. And that's good because then it's less anesthesia, less operating time, and that, of course, then decreases the cost as well.
Exactly. So is there do you see in the future any way of eliminating varicose veins before they start?
I don't know, Jim, but if you figure it out, let me know. We'll go in business together because
Okay.
It would be nice not to have to deal with this for some people. But really, I think there's going to be different ways of treating the vein in other fashion that would be even less invasive. There was a system that came out where you injected something in the vein and it sealed the vein, so you didn't even have to pass the probe or anything. But unfortunately, that hasn't been the standard of care at this point. So I think as time goes on, yes, we probably will find better ways to treat the problem. And we have over the past, like I said, decade or so. We also know that some of the causes of varicose veins can be addressed as well. So I think that's the other thing, is to try and stop them from coming in the first place.
Okay, let's once again review what people might do to help them, keep them from developing.
Well, certainly regular exercise helps, and trying to keep your weight at a manageable level. Being a female and having hereditary varicose veins, there's not much you can do about that. And of course, pregnancy does increase your incidence, but that's something that, once again, you can't necessarily prevent. The other thing is, elevating your legs and wear the stockings. If you have a job where you stand an extended period of time, it's best if you wear the stockings before you get varicose veins. And the best stockings to wear are the ones that are prescribed by a healthcare provider, which are graduated compression socks. They only have to be to the knee. They come from various pharmacies, and your healthcare provider can give you a prescription for them, and they usually will be covered by insurance for at least one or two pair per year, so you can exchange them or replace them once they become stretched out and are no longer functioning like they should.
All right. Now that the treatment seems to be a lot simpler than it used to be, are you finding that you're treating a lot more people for varicose veins?
Absolutely. One of the things we find is that many people come to my office and say, well, I didn't know there was anything I could do for these veins, or my relative had theirs treated years ago, but it really didn't fix the problem. And sometimes that was because the problem wasn't addressed appropriately, or the wrong procedure may have been done to address what their certain situation was. We find that educating people and making them aware that there are options. On the other side, oftentimes people will come thinking they're a candidate for the procedure, but they're really not. If you have a problem where the perforating veins are leaking blood from one system to the other, and it's really not reflux or incompetence at the groin level, then oftentimes the only treatment for that is to wear compression socks. There are some other procedures where sometimes you can treat the perforating veins, but those are less successful and certainly have an increase in complications. So we're always cautious in doing those type of procedures. But I think, once again, identifying if you have venous disease through your primary care physician or a person who deals with venous disease, vascular surgeons or general surgeons, and then getting the appropriate imaging studies to prove that you have the problem, and then evaluating what you're a best candidate for, whether it's surgical intervention, conservative treatment with compression socks, and maybe some lifestyle changes.
All right. So you'd be glad to talk to somebody who's got questions about varicose veins?
Absolutely. We see people all the time in my office in referral or self-referral for venous problems, and trying to help manage those, as well as to identify if it's a different problem where it can sometimes be arterial, where it's the blood flow to the leg or to the skin level, which is a different problem treated in a different way. And it's important to differentiate one versus the other.
It's probably a good idea to figure out which one it is regardless.
Absolutely. Blood flow is an important thing for living tissue, and your body, your skin, your tissues require an amount of blood flow to remain healthy. And so, yes, anytime you think that there could be an issue, it's important to get that situation figured out and resolved so that you can live a healthy life.
All right, here's the real test. How do they get a hold of you?
You can call my office at 715-735-8056. And once again, if your primary care provider would wish to refer you, they can reach me through the same number. And we are in the office Monday through Friday, every day in the afternoon, except Tuesdays. We're in the operating room doing venous procedures.
All right. Well, thank you for being with us, and we've learned a lot about varicose veins, and hopefully we'll help some people who are out there. Once again, this is The Doctor Is In, and Dr. Michael Karkkainen has been our guest today. Thanks for being with us.
Thank you, Jim. Pleasure to be here as always.
The Doctor Is In, brought to you by Bay Area Medical Center.